Welcome back. In this video, we'll work through several practical case-based projects to apply what we've learned about suicide prevention and postvention. You'll have the opportunity to develop a suicide prevention plan, create a postvention strategy for a family, practice problem-solving therapy, and engage in role-playing scenarios to assess suicide risk and implement a safety plan. Let's get started. Case 1. Developing a suicide prevention plan for a patient with chronic depression and suicidal ideation. Let's consider a patient named Sarah, a 45-year-old woman with chronic depression. Sarah has struggled with depression for over 10 years and has experienced several episodes of suicidal ideation, though she has never attempted suicide. Recently, she's been feeling increasingly hopeless and withdrawn. She has a history of self-harm and admits to feeling overwhelmed by life's demands. Sarah reports chronic pain and a lack of support from family members, which adds to her distress. Step 1. Assess the risk. First, we need to assess the level of suicide risk. We will directly ask Sarah about her suicidal thoughts, ensuring we're non-judgmental. Have you had thoughts about ending your life or hurting yourself? Do you have a plan for how you would do it? Have you ever made an attempt to harm yourself in the past? Since Sarah has a history of suicidal ideation and self-harm, it's essential to carefully assess the severity of her thoughts and whether she has access to means of self-harm. Step 2. Develop the suicide prevention plan. Given Sarah's chronic depression and suicidal ideation, we would develop a comprehensive suicide prevention plan. Safety planning. Help Sarah create a safety plan that includes emergency contacts, family friends, or crisis helpline. A list of coping strategies Sarah can use, such as deep breathing, journaling, or engaging in self-soothing activities. A clear commitment to safety, such as agreeing to avoid access to harmful means, e.g., medications or sharp objects. Cognitive behavioral therapy, CBT. Refer Sarah for CBT to address negative thinking patterns and learn healthy coping strategies. Medication. Discuss the use of antidepressant medication, SSRIs or SNRIs, to help manage her depression and reduce suicidal ideation. Monitoring is essential to ensure the medication is effective and that side effects are managed. Reflection questions. Why is it important to create a safety plan for patients with chronic depression and suicidal ideation? How can CBT help Sarah manage negative thoughts and improve coping mechanisms? Case 2. Developing a postvention strategy for a family. After a suicide, let's consider a family that has experienced a tragic loss due to suicide. James, a 34-year-old father, took his own life last week. His family, including his wife, children, and parents, are devastated by the loss. They're struggling with grief, guilt, and confusion about how to move forward. Step 1. Provide immediate support. The first priority is to provide immediate support to the family. Offer grief counseling and provide resources for survivors of suicide. Help the family navigate funeral arrangements, legal matters, and immediate emotional distress. Step 2. Addressing the family's emotional needs. Long-term emotional support is vital. Encourage therapy. Recommend individual and family therapy for all family members to address their grief and survivor guilt. Create an environment where they feel comfortable expressing their feelings without judgment. Many survivors experience shame, so normalizing their emotions is crucial. Peer support groups. Encourage family members to join groups where they can meet others who have experienced similar losses. This can help them feel less isolated and supported. Reflection questions. How can grief counseling help family members cope with the aftermath of suicide? What role do support groups play in helping families heal after a suicide? Case 3. Problem-solving therapy. Exercises for a patient experiencing worsening depression due to financial difficulties. Let's now look at a patient named Tom, a 38-year-old man who is struggling with worsening depression due to financial stress. Tom recently lost his job, and his financial situation has worsened significantly. This has led to increased feelings of hopelessness and helplessness. Step 1. Identify the problem. Tom's financial difficulties are contributing to his depression. We need to acknowledge these stresses and break them down into manageable parts. Start by asking Tom, "Can you tell me more about your financial situation? How has your current financial stress affected your mood and daily functioning?" Step 2. Brainstorm solutions. Next, we'll brainstorm potential solutions to Tom's financial stress. Some possible solutions could include seeking temporary work. Tom could explore temporary or part-time jobs to provide immediate financial relief. Financial counseling. Refer Tom to a financial counselor who can help him create a budget or work out payment plans. Accessing community support. Identify local food banks or financial assistance programs. Step 3. Create an action plan. Help Tom develop a clear action plan. Set small goals, such as applying to 3 jobs per week or meeting with a financial counselor. Create a schedule and set achievable targets so Tom can feel a sense of accomplishment as he works through these tasks. Reflection questions. How can problem-solving therapy help address external stresses, such as financial difficulties, in managing depression? What are the steps for helping a patient like Tom feel more empowered in dealing with their stress? Case 4. Role-playing scenario. Assessing suicide risk and implementing a safety plan. Now let's engage in a role-playing scenario where we assess a high-risk patient and implement a safety plan. In this scenario, the patient is Alice, a 28-year-old woman who has expressed suicidal thoughts and has a history of self-harm. During the role play, you'll practice asking the following questions. Can you tell me more about your thoughts of hurting yourself? Do you have a specific plan for how you would do it? What are some things you can do to stay safe when these thoughts arise? You'll then develop a safety plan with Alice, outlining coping strategies, emergency contacts, and steps she can take when she feels overwhelmed. Reflection questions. How do you assess a patient's suicidal ideation in a role-play scenario? What should a safety plan include to ensure the patient's immediate safety? Let's keep it going, and I'll see you in the next one.